You can hear me well?
I hear you loud and clear.
Okay. I'm Meg Callahan with Infectious Disease Special Edition. I'm here talking to Dr. Bob Hopkins, who's the medical director of the National Foundation for Infectious Diseases. Um, Flu's been really bad this year.
Yes, it has been a
Um,
bad season. Yeah.
yeah, so there's a new report that came out, and the numbers, I think specifically it was younger children, not babies, but younger, like, you can correct me on what the age range was. But the increase over the last 2 years was substantial in
It was visits. So I
visits.
think that's a combination of probably emergency department utilization, outpatient visits, and hospitalizations.
So I'm actually someone who has young children. That's scary.
Yes.
That's scary. Um, you know, why do you think this is happening?
Well, I think there are a number of pieces to it. One is we had a new influenza A strain, the K subclade of H3N2 that emerged this year. It emerged after we'd already selected the strains for the influenza vaccine for this year. Remember, most of the flu vaccine that we make in the United States is made based in eggs. And so it takes months to make the flu vaccine once strains have been chosen. And so this emerged in June in Europe, and it has caused a big increase in flu across the world, across the Northern Hemisphere anyway. And the United States is part of that. The report that you mentioned comes from Epic, which is one of the largest electronic medical record vendors in the U.S., tracks data from across the country and showed that peak influenza visits in children were up 90% higher than in children in the 23-24 season. And interestingly, 56% higher in persons 65 and older, but our adults 18 to 64, broken down into two groups, showed modest increases in the younger adult group and no increase in the 50 to 60-year-old group. And the highest increase affected school age kids, followed by kids 2 to 4, and then our youngest one, 0 to 2. And Epic has a powerful tool. They have the ability to track a number of different outcomes, including a number of communicable diseases. And it's good that we have multiple sources of data in our challenging world, shall we say, today.
What would you say to the people trying to navigate this hard flu season?
Well, I would focus on three messages. Number one, while we would have wished people would have been vaccinated earlier in the season to prevent some of these or to reduce the impact of some of these, it's still not too late to vaccinate. We still have a lot of influenza in our communities. And so if you have somebody that's not been vaccinated, try to get them through, getting that vaccine in arm because that's going to reduce the impact going forward. We are still seeing a lot of flu. Looking at the FluView report that came out on Friday, influenza activity is still high across much of our country, particularly in the South and Southeast, the Midwest, the Great Plains, and the Western United States. While emergency department visits are falling in most groups, except for our school age kids, which are reasonably flat over the last week, we're still seeing a lot of influenza A, the H3N2. We're seeing lots of influenza B. Influenza B is on the upsurge. And so I suspect in the next week or two, influenza B will take over. We often see influenza B late season, and influenza B often hits kids hard as well. So if we have the opportunity to get people vaccinated, and if they're sick, we want people to know, get tested and talk to their healthcare professional. We've got antivirals available, and antivirals can reduce the severity of influenza. And then on top of that, if you're sick, let's stay away from everyone else so we don't spread it.
Um, does vaccine hesitancy have to do with this, or is it too soon to say?
Well, I think our vaccine environment, our hesitancy environment, plays into all of these things. It plays into our conversations. It plays into how challenging it is to get people vaccinated. I don't think we have enough information now to know what the attributable portion of that is, but I think it's at least part of the puzzle. We talked about severity. So as we think about severity, we've seen a total of almost 80 pediatric flu-related deaths reported this flu season. That includes 8 additional pediatric deaths reported in the last week, and over 90% of those children were not fully vaccinated. So that again helps speak to the importance of vaccination. The CDC is calling this flu season moderate when you look at all age groups combined, but it's been a high severity flu season for children and more moderate in adults and older adults. The estimate is that we've had 25 million flu illnesses this year, over 330,000 hospitalizations and 20,000 deaths. So, this has not been a good flu season. And I think it's also important to think in context that we have a moderate to high amount of RSV going around in a lot of communities now. RSV and flu often circulate in the same period of time. COVID is not quite as hot in many areas of the country, although if you look at the respiratory viral panel or the respiratory viral report that CDC puts out, there's moderate community COVID activity out there also. So COVID, RSV, flu, norovirus is hitting really hard in a lot of parts of the country as well. So there are lots of respiratory illnesses out there. So we need to think about staying away from others when we're sick. We need to think about talking to our healthcare professionals when we're sick about the opportunity for antivirals to mitigate illness, and certainly getting people vaccinated if we have those opportunities.
Thank you.
You're welcome.
Thank you, Dr. Hopkins, for taking the time to talk to us.
Happy to do it, Megan. I hope you and your family stay well, and all of our listeners as well.
You too. Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.